My name is Nagendra Dudi-Venkata. I'm a general surgery / colorectal fellow at the Launceston General Hospital. General surgery started off as an interest because what we tend to see in this branch of specialty is there's immediate gratification by treating patients with operations, and you see them get better. And I think that's the initial spark which really leads most of us to get into general surgery. Now, colorectal cancers are one of the most commonest cancers seen Australia-wide, and in fact, its highest incidence is over here in Tasmania. And nowadays, there's an emergence of cancers coming in an early age in patients less than 50 years old. And this project is all about understanding the landscape of patients having these cancers at such an early age. One of the things how we pick up colorectal cancers is doing colonoscopies. And we do large number of colonoscopies on a daily basis. Now, with the emergence of early onset colorectal cancers in younger age group, that we need to tailor to the population which requires it to be done in a timely fashion, considering these cancers are coming at an early age group. But that can't be done if there are a huge number of colonoscopies being done and there's a huge waiting list. So research like this, like early onset colorectal studies, would give us an idea of when to tailor colonoscopies to what population, and we can have more criteria induced in the practice. Now, the second thing, some insightful publications about early onset colorectal cancers have also pointed that these cancers, for some odd reasons in the younger age group, tends to happen on the left side or around the rectal side of the bowel, which essentially gives you an opportunity is that can we get away by just doing a flexible sigmoidoscopy rather than a full colonoscopy. Now, this is only possible because we've analyzed some data which was already available. So that can even have a paradigm shift in the way we practice our endoscopy practices. So that can also still pave way to come up with management strategies, how we handle early onset colorectal cancers. There's a huge data set available around the world for cancers occurring in the older age group. The major limitation has been so far that this emergence of cancers in a younger age has occurred in the last decade. And there's not many data sets available to even interpret it. Thankfully, my colleagues in Ireland have started a registry called Research in Early Trends of Colorectal Cancer Trends, REACT Collaborative. They've accumulated data from 40 countries with around 135 hospitals. So they've asked the hospitals collect this data on a 15-year retrospective basis. So what we are doing in this project is contributing our share to the greater good in understanding this disease entity in a better way so that we can eventually help patients improve their clinical outcome. In fact, by 2034, it's predicted almost 1 in 10 colonic cancers or 1 in 4 rectal cancers will be under the age group of 50 years. There's almost 100% doubling rate in the incidence of colorectal cancers in this age group. And that's why this project is important, that we capture what's happening to have a mapping of the landscape of what we are dealing with. And then we go forward to see what can be done about it. Firstly, thank you for your gracious support to this project, because it helps me strive doing more practical clinical projects to overall influence the well-being of the community. And it's not just the monetary funding, it goes beyond that. It actually shows the testament to the power of that community with a shared hope for a better future. I think, so thanks for that. What I would want from the community members is to be aware that there is an increased incidence of colorectal cancers in an early age group. Please do refer and talk to your general practitioners, GPs and doctors about this program. Participate in this program as much as possible, because that's one thing which is not huge again in Tassie population. The participation rate compared to the other states is pretty low. I've been very lucky to have huge support from the Department of Surgery here, and also from the gastroenterology, especially Prof. Nick Shackle and the Craig Foundation. I have a very strong belief in whatever we do as clinicians in the healthcare sector, our primary focus needs to be by default patient outcomes.